Hello everyone, welcome back. My name is Dr. Vijay Bhatia. Today we are going to talk about reactions to stressful experiences. Stressful events frequently provoke psychiatric disorders, not always, but frequently. Such events can also provoke emotional reactions that are distressing, but they are not severe enough or they are not prolonged enough to meet the diagnostic criteria for anxiety or depressive disorder. Components of responses to stressful events. Any stressful event can trigger a response, and it can be an emotional response or somatic response and a psychological response. Emotional and somatic responses are of two kinds. Number one, the first kind is anxiety with autonomic arousal that leads to tachycardia, that means increased heart rate. You can feel that your heart is racing, palpitations, increased muscle tension, that your muscles are getting tense, they're getting rigid, you are sweating a bit more, your mouth is getting dry. And these anxiety symptoms are mainly with events that pose a threat either to you as a person, to your life, to your family, to your loved one. And in the circumstances of any threat, the body reacts by having the increased heart rate. This reaction is in a way for you to be prepared for fight, flight, or freeze reaction. So it is up to you which one that person uses according to the predisposition of that person. Either they want to freeze in the situation that they can't do anything, or they run away from the situation, or they fight for it. The second kind is the depression. What happens here is that there is reduced physical activity. You become as if you are helpless and sometimes even hopeless. And this is mainly with the stressful events which are associated with separation, divorce, bereavement, somebody loved one goes away, passes away or dies or faces an accident in which there is some kind of loss, or there's another kind of loss where you might have lost your job, might have lost your partner, might have lost in your business, finances. So it can be reaction to the loss. And the psychological response, the third type of response, comprises mechanisms that normally reduce the impact of the event. So as a human being, you want to minimize the effect of the stressful event, thus limiting the emotional and somatic reactions as we have seen in the previous slide. Two groups of psychological mechanisms have been described to deal with any stressful situation. Number one is called coping strategies, and number two is the mechanisms of defense. We will talk about these in more detail one by one. Coping strategies and mechanisms of defense can reduce the effect of the strong emotions generated by stressful events. We call them stressors. In this way, normal performance can be maintained. that is adaptability of the person as a human being. The term coping strategy is derived from research in social psychology. It is applied to activity which the person is aware. For example, deliberately avoiding stressor. The important point here is the awareness, that you are aware that there is a stressful event, and you are also aware that you might develop some kind of emotional response and some kind of somatic symptoms, and if they are mainly with the loss, you might suffer with low mood and low activity and depression, and if it is a threat, that you might have physical symptoms of racing heart, muscles getting tense, sweating, dry mouth. So you are aware of these. Once you are aware of this, then you can apply certain mechanisms to overcome these stresses. The term mechanism of defense is derived from psychoanalytic studies, and it refers to unconscious mental processes. Now see the difference. In coping strategies, you are fully aware. It is by the conscious mind. Whereas mechanisms of defense, they are unconscious mental processes, and they are there to protect you as a person for your survival. And these are unconscious processes. For example, denial, that you want to simply ignore it. And that is not conscious, it is unconscious here. The third term, adaptation, is sometimes applied to the psychological processes involved in adjustment to stressful events associated when there is prolonged stress, something like chronic illness. So coping strategies can be adaptive, they can be maladaptive. If they are maladaptive, there can be two types. One is problem solving, another one is emotion reducing. For problem solving, they can be used to make adverse circumstances less stressful. That you identify the stress, you want to solve the problem, and in times you might want to get away from the situation, or you might want to involve another person, and you are in a process that you want to solve the problem, and that will be adaptive strategy for coping with that stressful event. The other one is emotional reducing. Again, it is adaptive because you are recognizing your emotions, that your muscles are getting tense, you are sweating a little bit. You might get into problem if you remain in the situation, so you want to just take a deep breath and get out of the situation, or hold the hand of your loved one, or you are with somebody. So these are adaptive, emotion reducing strategies to overcome the stressful situation or event or circumstances, and can enhance your adaptation to stressful circumstances. The other coping strategy can be maladaptive. Maladaptive coping strategies include use of alcohol or illicit drugs or non-prescription drugs. It can be deliberate self-harm. It can be histrionic behavior, aggressive behavior. Although maladaptive coping strategies can reduce a person's response to stressful circumstances in short term, however, they may lead to greater difficulties in long term. So in this situation, there is a stressful event, you have a fight with your partner. What you do, if you are in a maladaptive coping strategy, you might go and use alcohol to calm your nerves And every time this situation happens or in similar situations, you keep on doing, you become addicted to alcohol as a way of your coping mechanism strategy. And in the long run, that may cause problems to you. Some people, if they are in a situation, in a stressful situation, they don't know how to deal with that, they harm themselves, either superficially or take some overdose or suffer a pain and believe that they deserve pain, and in the process their anxiety is relieved. Or in the third situation, the person might get into histrionic behavior, dramatizing as if they become ill, or they display that they can't move their arm or leg, or they they behave in a way where they want to seek the attention from the other person. For example, if you are faced in a boyfriend is leaving you, you take overdose, you go to the hospital, and in the process the partner or the boyfriend comes back, and so you are getting reward from that your partner is coming and seeing you, so you are getting attention. So that can be your histrionic behavior, not always though. Sometimes the situation is so difficult that you don't know how to react, and you might become aggressive when the stressful situation comes. And that is again a maladaptive, because in the long run this can give you more problems rather than benefits getting into that mode. Problem solving strategies can be employed where there is a way, this is a psychological response to minimize the effects of the stressful event situation. And you might want to actually solve the problem, and are looking for the strategies for that, and you don't know yourself, and you might go and seek help from another person, somebody you trust, somebody you believe is in a position to help, or obtaining information or advice that would help to solve the problem, because this situation is stressful to you. It is giving you somatic symptoms, it is giving you emotional symptoms, anxiety and depression, and you have not employed the strategies that could have resolved the situation. So psychological adaptation will be to go and seek help from a third person or obtain information or advice that would help to solve the problem. It can, it may not, but it is a good psychological response to have these in your hand. Problem solving, making and implementing plans to deal with the problem. So when you have a problem that is giving you stress, making you feel tense, you want to come up with a plan that will help you to deal with the problem. The problem might be that you want to not go in that situation and avoid the situation and let third person resolve the issue, or they might give you certain action plans that in that situation next time you act like this or do like this, and you implement those plans if the problem arises again, rather than getting to the maladaptive coping strategies, going and drinking alcohol or harming yourself. The third one is the problem solving strategy is getting into confrontation. That means you want to defend your own rights, and you might involve persuading another person to change their behavior when either action would help the person. So the idea is to relieve your tension, relieve your symptoms, relieve your um, uh, pressure on your body from the stressful situation. So you will defend yourself that this is my right. And you might be able to persuade the other person to to resolve the situation and solve the problem. And both these situations can actually help the person to uh, dampen their symptoms from the stressful situation. Emotion reducing strategies. Now, first one is ventilation of emotions. What you do is you go and talk to another person who is understanding, listening, neutral, non-judgmental, and you express your emotions to them. They will listen to you. They may not come up with any ideas, but simply listening to your emotions, understanding your emotions will help you reduce your emotions. The other strategy can be avoidance. Some people use this more often than they should. So in what happens in avoidance, you are refusing to think about the problem or problems. You avoid avoid people who are causing these problems or avoiding reminders of the problem. So whatever way you want to do, you don't want to get upset, you don't want to get tense because you feel uncomfortable with racing heart and sweating and muscles getting tense and then aching and painful. You don't want that situation. You tend to avoid even the triggers, even the reminders of those things that cause the problem. The other strategy is positive reappraisal. What happens is you recognize that the problem has led to some good. For example, for your own betterment, for the betterment of your family, for the betterment of your circumstances. So let's say, take example that somebody has lost job and he didn't like the job anyway. So he will recognize that yes, I have lost my job, but I will look for another job which will be for my betterment because I didn't like this job, so I lost the job. It is good in a way. But a lot of other people may not think like that and may go into anxiety and depression. So it's good emotion reducing strategy to have the positive reappraisal of the stressful situation. Accepting and rejecting responsibility. Recognizing that one is wholly or partly responsible for the problem and can deal with it, or that one is not responsible and need not react. So there is a stressful situation and you either say, yes, I am responsible, even that can reduce your emotional symptoms. Or you say, I am partly responsible, you accept that and take the responsibility. Again, just accepting that might reduce the anxiety symptoms. Or on the other hand, if you know that you're not responsible for that, therefore your psychological well-being will work with you and let you deal with the situation and resolve the situation of your anxiety. At least you are looking after yourself and being faithful to yourself. Coping strategies in general are useful in reducing the problem or in lessening the emotional reaction. So there are two things. One is the situation itself that is causing the emotions, and there is you who is having the symptoms of those emotional stressful events. So your physical symptoms and emotional symptoms. So they are helpful. Coping strategies are helpful in reducing the problem or your own emotional reactions. However, they are not always adaptive, as we have seen that they can be maladaptive, that you go and start drinking alcohol, deliberate self-harm, or illicit drugs, or over-the-counter drugs, which may not be helpful to you. For example, avoidance may not be adaptive in the early stages of physical illness because it can lead to delay in seeking appropriate treatment. If you are denying, if you are in a denial phase, or if you are in a not adaptive strategy, and you are in a maladaptive strategy like avoiding, I got this chest pain, I can wait and see how it progresses. And if you keep on waiting for a long time and try to avoid seeking help from the professionals, then you might delay the treatment that might help you in the long run. Hence, a person needs not only the ability to use coping strategies, but also the ability to judge which strategy to be used in which particular circumstances. So avoidance in physical health may not be helpful, but a avoidance in a kind of where you are in an argument or fight with somebody, at that stage, if you want to get away from the situation or avoid that confrontation, then that will be positive. So you need to judge every circumstance and situation and apply the appropriate coping strategy. Coping strategies used in Alcoholics Anonymous. People are advised to seek the courage to change what can be changed. So this is a person who has been dependent on alcohol and has been for years, and it is causing some side effects, some harmful effects either on the stomach or the liver or the physical relation of finances or work. And what happens is they come into the rut, into the habit, they can't stop. So the coping strategies are given to these people and they are encouraged to change what can be changed. They are not they are advised, not forced. The serenity to accept what can be changed and giving them strategies to give them what make them feel good, what make them feel more comfortable, by giving support and even some medications, that if you change this, if you stop alcohol, we give you some medication that will help you to stop those withdrawal symptoms, and in the long run you will be better off and you can have a happy and worthwhile life. And the wisdom to know the difference. So these people are given these strategies, coping strategies, to deal with the situation in Alcoholics Anonymous. It might help, it may not help, but it is good to keep on trying because these are the strategies that can help and has helped. What about the maladaptive coping strategies? Use of alcohol or unprescribed drugs to reduce awareness. The important bit here is because all these coping strategies, they are to make you fully aware of the situation, of all the things that you need to know. If you are using alcohol, if we tell you that alcohol in the long run will damage you, because the person may not understand, may not be fully aware of that. So to reduce the awareness of stressful circumstances, even in this situation, the person is using to reduce the awareness because the person does not believe that he will be able to cope with that situation or stressful event. So they go and drink alcohol to reduce their awareness, but in the long run that can be harmful. Another maladaptive coping strategy, deliberate self-harm, either by drug overdose or self-injury, sometimes to induce pain as a way of reducing the tension. This can happen in people who suffer with anxiety disorders. Histrionic behavior and unrestrained display of emotion may reduce tension and in some societies such behavior is sanctioned in particular circumstances. For example, in grieving, such behavior can be adaptive, but it can also damage relationships that would otherwise have been supportive. Aggressive behavior, overt aggression, may release pent-up feelings of anger and provide immediate release. In longer term, however, it damages relationships and increases the person's difficulties rather than reducing them. Coping styles. When particular coping mechanism like alcohol or self-harm or deliberate self-harm, it becomes repeatedly being used in different situations, they are said to constitute a coping style. So coping style is nothing but the repeated use of maladaptive patterns of behavior or adaptive patterns of behavior in similar stressful situations or different stressful situations. They always react in a histrionic way, or they always go and drink alcohol. And if they keep on using the same method, then that will be their coping style, and in the long run can be part of their personality in that field. Some people change their coping strategies according to the circumstances. For example, they use problem-solving strategy in one kind of situation but employ avoidance in another situation. Some people habitually use maladaptive strategies. For example, they repeatedly use alcohol or take overdoses of drugs when under stress, and that will be their coping style if they use it repeatedly, the same strategy. If you like this video, press the like button, share with your friends, and subscribe the channel. Thank you for watching.